Hello everyone, welcome to my channel. Today we have another surgery question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 61-year-old woman is evaluated in clinic for a persistent sore on the bottom of her left foot. She first noticed the wound about 5 weeks ago after removing her socks, but she does not remember stepping on anything or injuring her foot. Despite using a specialized diabetic footwear and keeping the ulcer covered with appropriate dressings, the wound has not decreased in size. The patient has a history of type 2 diabetes mellitus complicated by peripheral neuropathy and chronic kidney disease. She also has hyperlipidemia and well-controlled hypertension. She denies foot pain, drainage, foul odor, fever, or chills. On examination, vital signs are within normal limits. There is a 2.8 centimeters ulcer over the plantar surface beneath the first metatarsal head of the left foot. The wound basis appears clean with healthy granulation tissue and minimal serous drainage. There is no surrounding warmth, erythema, fluctuant or purulent discharge. Sensation to light touch and vibration is diminished in both feet. Which of the following is the most appropriate next step in management? So first things first, we need to think of a potential diagnosis, and we have a 61-year-old patient. She has diabetes, and for 5 weeks she has been dealing with a foot condition with an ulcer that's 2.8 centimeters deep, which is quite deep. And whenever we have such patients with diabetes and such foot conditions, severe long-lasting foot conditions, we need to think about osteomyelitis, which is the infection uh, of the bone. And with that being said, let's look at the answer choices. A. Begin vitamin C and zinc supplementations. So deficiency in vitamin C and zinc could delay basically wound healing. But in this case, we need to rule out osteomyelitis first, and then we can think about these other conditions as well. B. Apply topical antibiotics ointment with each dressing change. Yes, that's a good practice, but if the patient really has osteomyelitis, then we need to provide systemic antibiotics rather than topical ones. So I wouldn't say B is the best answer choice. C. Initiate hyperbaric oxygen therapy. So hyperbaric oxygen therapy can be used in basically diabetic foot ulcers that are not healing fast enough, but we first need to rule out osteomyelitis first, because if we want to do the hyperbaric oxygen therapy, we need to provide special antibiotics and do some debridements if the patient has osteomyelitis before we do the hyperbaric oxygen therapy. So C, not the best answer choice. D. Obtain imaging of the foot to evaluate for underlying osteomyelitis. This could be the good answer choice because we want to make sure whether the patient has osteomyelitis or not. It seems like she has it, but we want to make sure. So I would say D could potentially be a good answer choice. E. Perform arterial imaging of the affected lower extremity. So when a patient has diabetes and hyperlipidemia and hypertension, there is a risk that the patient might also have peripheral vascular disease. And with that, if we want to diagnose it, we need to do arterial imaging of the affected lower extremity. But right now, our concern is bone infection, and this comes secondary to that. So I would say, all in all, D is the correct answer choice. And thank you very much for watching this video, and don't forget to like and subscribe. Thank you.